This story is from Peru, and it may take you by surprise. Peruvian authorities have declared a state of national health emergency for 90 days. Why? Because of a rare but serious neurological disorder called GBS or Guillain-Barre syndrome. Many of you may never have heard of this medical condition simply because it is quite rare, though serious, as we said. In the United States, the probability of GBS is 1 in 100,000. But in an astounding development, GBS has triggered a health emergency in Peru. That's because the Southern American country has witnessed a sharp and highly unusual surge in GBS cases. Since last month, that's June 2023, at least 182 cases of GBS have been reported in Peru, with at least 4 deaths resulting from the disease. 147 people have been discharged from hospitals, but over 30 still remain hospitalized. Rising cases of GBS have increased the pressure on already strained health services. The official government statement says the growing caseload negatively impacts the continuity of health services as there are not enough strategic resources to respond to the volume and complexity of these cases in health facilities. There has been a significant increase in recent weeks that forces us to take action as a state to protect the health and life of the population. That's what Peru's health minister, Cesar Vázquez, has said. Just what is Guillain-Barre syndrome or GBS, and why is it wreaking havoc with Peru's healthcare system? GBS is a rare neurological disorder and an autoimmune disease that prompts the body's immune system to mistakenly attack its nervous system, sometimes leading to paralysis. Just like with any other autoimmune disease, the immune system of a GBS patient starts attacking their healthy cells instead of the sick cells. GBS can affect any part of the peripheral nervous system, which is the nervous system outside the brain and the spinal cord. When GBS sets in, the patient's myelin sheaths of peripheral nerves are attacked. The damage prevents the nerves from sending certain information such as touch sensations to the spinal cord and the brain. GBS causes a sense of numbness. The brain and the spinal cord can no longer transmit signals back to the body, thereby causing muscle weakness. Now, the exact causes of GBS are not known, but people with an immunoglobulin deficiency are more prone to it. Reports also suggest that 2/3 of GBS patients saw symptoms of an infection such as COVID-19 or a gastrointestinal infection or Zika virus in the 6 weeks preceding the onset of GBS. According to the US Centers for Disease Control and Prevention, or CDC, about 2 in every 3 people with GBS had diarrhea or a respiratory illness several weeks before developing GBS symptoms. The CDC also links GBS with viral infections like the flu or other infections. There's also been a link with vaccination, though that is thought to be quite rare. GBS is not contagious and cannot spread from one person to another. This syndrome starts with a tingling sensation and weakness in the hands and feet and can quickly spread further, ending up paralyzing the body. Most people with this condition need to be hospitalized for treatment. Let's look at the symptoms of Guillain-Barre syndrome in some detail. As we said, it causes a tingling sensation in the fingers, toes, ankles, wrists, or sometimes even arms and face, weakness in the legs that then spreads to the upper body, in some cases an inability to walk or climb stairs, difficulty with facial movements, speaking, chewing or swallowing, double vision, or an inability to move eyes, severe pain that may feel achy, shooting or cramp-like and is likely to get worse at night, difficulty with bladder control and bowel function, a rapid heart rate, low or high blood pressure, and difficulty in breathing. The most severe GBS cases are likely to end up in paralysis. GBS occurs in 3 forms: acute, inflammatory, demyelinating, neuropathy or AIDP, the Miller-Fisher syndrome or acute motor axonal neuropathy. AIDP is the most common form found in North America and Europe. The most common sign of this form is muscle weakness that starts in the lower body and spreads to the upper body. In Miller-Fisher syndrome, the paralysis starts with the eyes. This syndrome is less common in the US and more common in Asia. The acute motor axonal neuropathy is more common in China, Japan, and Mexico. The diagnosis of GPS is difficult, particularly in the initial phase, as the symptoms overlap with those of other neurological conditions. The doctors consider how long the symptoms have lasted, how fast they spread, and if they are on both sides of the body. Certain neurological tests are required in such cases. As for the treatment, there is no specific cure for GBS, but symptoms can be treated and the condition managed. The UK National Health Service says most people are treated in hospital and usually need to stay there for a few weeks or a few months. The two main treatment options for GBS are immunoglobulin therapy and plasma exchange. In IVIG, donated blood containing health antibodies is given to a person with GBS. It's an intravenous treatment and is the most common method to treat GBS. In plasma exchange, a person's blood is taken and harmful antibodies are filtered out in a machine. The treated blood is given again to the person. Besides these treatment options, blood thinners can also be given to prevent blood clotting. A person can also be put on oxygen support in case of breathing difficulties. Well, that's all the time we have on Global Lens tonight. If you have been, thanks so much for watching. Do join us again tomorrow at the same time. Till then, goodbye.